So welcome everyone to our second webinar from the Chronic Pain Network Patient Engagement and Research Rounds. And this first slide is just a reminder again that we've set up these rounds so that we can share within our own network expertise or experiences that people have had within patient engagement and research. And so we've kind of taken it from the idea of hospital rounds about sharing internally. And our hope is that, as we grow as a network and our experiences grow, we can continue to add to our collective knowledge of patient engagement and research in these rounds. So before I hand it over to our speakers today, I'm just going to tell you a bit about them. So we have Mary Brachaniec, who's with us, and she's a retired physiotherapist. She's been very heavily engaged in the arthritis community for many years, and she served also within CIHR's IMHA, Knowledge Exchange Task Force, and obviously what she's here to talk about is her experience with the Cochrane Collaboration. And Mary sits on our network's Knowledge Translation Committee. And then Mary is going to co-present with Janet Gunderson. And Janet, too, has been a really active volunteer within the arthritis community for more than 15 years. She sits with me on the steering committee of the Canadian Arthritis Patient Alliance, which was formerly the Consumer Advisory Council for the Canadian Arthritis Network. And Janet is active within the Cochrane Musculoskeletal Group. And Janet is an active participant in our network patient engagement committee. So I'm going to hand things over to Mary and Janet. I'm going to ask that you please hold your questions until the end of the webinar. And feel free to type them into the chat message that should be on the right hand side of your screen as well, and we'll take those we'll take those questions at the end and answer them. So I'll pass it now over to Mary and Janet.
Thanks, Dawn. The Cochrane Collaboration is a nonprofit organization that produces evidence-based systematic reviews that are free from commercial sponsorship. They are published in an online library called the Cochrane Library. Cochrane reviews are regarded by the health and medical communities as being a very high quality and trustworthy source of health evidence. The results of these reviews are often used to inform health policies and health practices. The Cochrane Collaboration refers to patients that work with them as consumers, whereas the Chronic Pain Network calls us patients, so the term is used interchangeably in this presentation. The logo, which is seen on the left, the circle with the purple in the middle, provides an excellent example of how systematic reviews have impact. The logo depicts a forest plot, which is the purple in the middle, and it's just a graph showing the results of 7 randomized control trials, RCTs, that were completed in the early 70s. These RCTs tested the effects of giving a short course of corticosteroids to women who were about to give birth early. The evidence clearly showed that the short course of corticosteroids reduced the odds of these babies dying prematurely by complications up to 30 to 50%. This information was not published worldwide at that time. The studies were reproduced again in 1991. The lives of many babies likely would have been saved had the systematic reviews been completed and published worldwide earlier. This is a screenshot of the Cochrane Library. We'll give you the website information later. Once you log on to the Cochrane Library, you can scroll down and look at different topics, and there is a pain topic. The library can be a bit difficult to use. There are tutorials on how to use it. The key is in the search box, you need to put in a specific question. In our case, does exercise help fibromyalgia? If you put in just fibromyalgia, there's 49 reviews on fibromyalgia. So remember a specific question. The reviews can be quite lengthy and not all that useful to read parts of them. I tend to jump to the author's conclusion and the lay summary or the plain language summary. Cochrane calls it a plain language summary. We call it a lay summary. So the reviews can also be frustrating because they have very stringent rules for stating the evidence, and often the review will state that more RCTs are needed because there isn't enough evidence. This slide shows the many steps to doing a systematic review. If you start at the top, the royal blue research question. A systematic review is an impartial study of the results of the available published medical studies on any research question in health or medicine. The process starts by writing a protocol which asks a very specific question. The literature search is done to determine studies that qualify to be grouped together. This slide shows a number of steps that are completed when doing a systematic review. The final step before publication is writing the lay language summary, or what we would refer to here as the lay summary. And then the review is published in the Cochrane Library. So the protocol is written and then go through all of those steps until it, of course, goes to editing. And the lay language summary is done before it goes to editing. In our case, we reviewed the entire review because we're on the writing team. Mary will tell us about her involvement.
So I was honored to represent CAPA, or the Canadian Arthritis Patient Alliance, and the Arthritis Society on this Knowledge Exchange Task Force for CIHR IMHA, or Institute of Musculoskeletal Health and Arthritis, from 2004 to sometime in 2010. Basically, IMHA covers research relating to bone, joints, muscle, skin, oral health, and MSK rehab. So the Knowledge Exchange Task Force, way back in 2004, we were one of the first groups that really came together, patients, to work on knowledge exchange or knowledge translation. And Dr. Cyril Frank from Calgary, he was scientific director at that time, and Flora Dell were really the prime movers to get the group going. And our main objectives were to help to shape research priorities of the Institute itself, and then to share new knowledge that was coming out of the supported studies from IMHA. And so in 2006, we were asked to form groups, knowledge exchange tasks, split into some working groups, and select any Cochrane systematic review in which to help to share the results with patients and the public. So we looked through some of the reviews that had been completed, and we saw that the 2002 Cochrane review on fibromyalgia and exercise, the most up-to-date review at that time showed some significant benefits in terms of symptom management from exercise. So we selected that review. We actually contacted the review authors to find out that they were updating the review yet again in 2007. So we decided to work with the authors, wait till the new review was published. And so we were targeting, we wanted to share our key messages with patients primarily with fibromyalgia, and to some extent the public. And we had some key messages ready to go, and we were working with the Canadian Physical Therapy Association on that. But as Janet mentioned earlier, sometimes these reviews, when they put all the evidence together, really they're a little wishy-washy in terms of the results. And this is what happened in this review. Once all of the evidence was gathered, that really, at that time, they didn't have really significant, they couldn't say, this is definitely going to help your symptoms at that time. They needed more evidence. So what we decided to do was to switch our target audience, because the next step would really be for the research community to do those RCTs in order so that the next Cochrane review, they'd have something more substantial to say and to share. So that's what happened with this project. The Cochrane review team was based out of the University of Saskatchewan. Dr. Angela Bush was the lead author on the team. So what we did was we used a format that had come out of the British Medical Journal about the best way to package research gaps coming out of either systematic reviews or other studies. And so we took the PICO, which a lot of people will talk about in research as population intervention comparison outcomes. And we added E and T to the beginning and end. And we worked with the authors to package the gaps in the evidence at that time. And we used this BMJ recommended format. And we shared this information with as many research funders and fibromyalgia researchers as we could at that time. And we were really pleased to be invited by the Canadian Physiotherapy Association to capture this project as a guest editorial in their journal. So we did that, and you know, really we're promoting patient involvement, patient engagement in research, and knowledge translation. So we were proud of that, but lots of work left to be done. So what happened after that is the review team, led by Angela, invited me to join the actual Cochrane review team itself, working on the next reviews that the team was doing on exercise and fibromyalgia. And it was at that time, Cochrane mostly involved consumers or patients towards the end of reviews in terms of feedback, but it was quite new at that time to bring in patients early. So in 2011, we presented what we were doing in a poster at the Canadian Cochrane Symposium. And you can see here that there's been a lot of growth in patient engagement. Just looking at the little square at the bottom of the second column, consultation, collaboration, control, levels of consumer involvement. We've all seen in some of the PE models that, you know, a lot has changed since then and grown. But at this time, it was new to us, and it was exciting, and it was quite well received at the symposium. So after that, basically, we realized that we needed another patient representative, and so we used the International Cochrane Consumer Network, which is basically worldwide, their communication email listserv, to ask another person, another patient representative who either had fibromyalgia or was interested in fibromyalgia to join us. And Janet, who actually lives in Saskatchewan, just kind of by chance almost, was interviewed and joined the team, and she really was in the best position to join us. And so I'm going to pass on to Janet now.
When I was interviewed, I was presented with a document giving me a clear set of expectations that was called a Terms of Reference. I knew that I would have to prepare for calls at least once, often twice a month, and these calls were usually an hour and a half long. Although I don't have fibromyalgia, I had been involved with the Cochrane Collaboration for many years, but I will admit that I didn't fully understand how complicated and time-consuming doing a systematic review was. Some of our tasks were assisting in evaluating outcome measures important to consumers. We would have a separate meeting for that with Angela, with just the two consumers and Angela usually. We would express concerns from the consumer perspective. We provided reflections on summaries of fibro studies included in the reviews. We helped to identify research gaps and priorities for future reviews. We also were involved with the written work and knowledge translation. We would review the manuscripts and provide feedback regarding understandability and usability for lay audiences. We'd assist in developing plain language summaries, or lay summaries, if you want to call them that. And we'd help develop plans for sharing the reviews with key stakeholders, including consumers. We were able to use free technologies that allowed for Canada-wide participation, and in fact, it became worldwide as one of the people moved to England and then Norway. Angela and the team spent much time explaining terminologies and any other questions that we had. We ended up including glossaries and had access to all of the files. The full manuscripts were made available to us before they were sent into editing, and then we had to comment on them. Angela and Mary and I met to determine the outcome measures that would be used. On the slide, you see some of the free technologies that we used: Skype, Blackboard, Collaborate, Google Drives, and Dropbox. Mentorship and training was sort of given as needed, often at the end of a phone call, and I did meet personally with Angela because I live close enough a few times. Information needs such as glossaries were added to the reviews. I found, being not of a physiotherapy background, I was not used to the terminology where Mary was because she was a physiotherapist, so I asked probably some pretty dumb questions on occasion, but I was never told that they were dumb. It was always handled very well. And as I say, the copies of reviews and files were made available to both Mary and I at all times. This slide just shows how members of the teams were distributed across Canada, and like I say, Julia ended up moving to England and Norway. We used technologies like Skype and Blackboard, and that allowed us to meet monthly without a cost to the team because they're not paid to do these reviews. This is a slide of Mary and Angela and myself. We're at a Vancouver symposium. It's Mary on the left. I'm ashamed to say it's me in the middle after a half a glass of wine, and Angela on the right, Dr. Angela Bush, and she is the lead author. We discovered there was too much literature, so we ended up breaking it up and doing several systematic reviews. One of them was on resistance or strength exercise, another on aquatic, which of course is water, one on mixed exercise, another on aerobic exercise, flexibility, a vibration review, which I think was pretty new to most people while we did it, and an umbrella review, which was not a Cochrane review. Systematic reviews can be done on their own, not necessarily through the Cochrane Library. I sent in an abstract to present a poster at the International Cochrane Colloquium in Quebec for 2013. The poster showed the model this team used that included consumers in the writing process from the beginning of the process. As Mary said, traditionally, Cochrane reviews only involve consumers at the end. So we wanted to describe the role and our experience as consumer volunteers. The model used by the writing team was described. We wanted to present our challenges and our successes and show how a cross-country team worked together. To show this approach used by the team hoped to serve as a model for other Cochrane review teams to include consumers at the beginning of the writing process. This is a picture of the poster. I know it's hard to read because it's small. There was quite a bit of interest about the process that this writing team had done and what roles the consumers played. Several review authors from other groups were asking very specific questions when we presented the poster. I think that it was a new concept to many authors at the time, but there was quite a bit of interest from different review groups and different authors. Mary and I also did an oral presentation at the same conference, and Mary will tell you about that.
So we were absolutely thrilled to have the opportunity to lead a workshop at this international worldwide event, and really we were so supported by our research team in submitting the abstract and moving forward with the workshop, and the Cochrane musculoskeletal group who helped us with it as well. So what this whole thing was it was about asking the participants. We had 16 participants altogether at the workshop, 12 of whom were patient representatives. So we wanted to have a brainstorming technique with everybody having an equal voice. in terms of how they would want to receive the results of the Cochrane reviews on fibromyalgia and exercise that we were preparing to publish. So what we did was we generated, people brainstormed, we wrote them out on little sticky notes, and then we ranked them, which were the most, the best way for people to receive the information, and then to the least well-ranked knowledge tools. And we asked two really specific questions of the participants. So it was kind of, the brainstorming was split up into two questions. And the first question really was how to best package the results. So it was, we'll have the information coming out. Let's start with, say, the resistance review, so the strengthening exercise in fibromyalgia. So this is the review, this is the lay summary. So how would lay audiences want to receive it, and what would be the best way for them to receive it in order for them to maybe change the way that they exercise, or to understand the impact of resistance exercise in fibromyalgia. So that was their first question. And basically, we'll just move on to the first column. So what we did was we just put up a slide, and we presented the ways that Cochrane was sharing research results at that time in 2013. So we had the lay summaries. Patient decision aids were starting to be used then. So the results could inform a patient decision aid that could be used at the point of care by patients before appointments or during. And then Twitter was just starting out really then and gaining momentum, and podcasts were starting to be used a little bit. So those were some of the ways to package the results of the reviews. And then we also talked about potential future ways of packaging our results. And it's interesting because now we can look back in 2017 and we actually see that now a lot of these ways of sharing research results are actually being used now by groups such as Cochrane. So there's Facebook, YouTube, mobile phones, apps, results via apps. There's praised websites like PubMed Health, Medline Plus, even things like Wikipedia. Cochrane has partnered with them, so we don't have that there, but that's another way that they share evidence. And then webinars and animations, cartoons, and that type of thing can also be used. So this was the sort of the discussion. We just gave examples of ways that we could package the information. And so we had the brainstorming and the ranking exercise with that question. And then the second question really was, okay, so now we have this information packaged in this way. So now what's the best communication channel to share this packaged information? So that was question 2 for our audience. And we presented the results at an upcoming Cochrane Symposium, and Janet is going to talk about that now.
Some of the results we found, of course, were that the lay summaries were a key tool. Newer media formats like websites and blogs were also suggested. Webinars and podcasts. We did have one podcast for sure. I'm not sure if there were 2. A lot of people from countries that don't have as much access to internet as we do suggested mobile phone apps. That hasn't been done yet because I guess mobile phones are used a lot more, I guess because they don't necessarily have as much internet access. One thing we had not thought of is people had suggested animations or cartoons. So we need a knowledge tool for health professionals to share with patients to address uncertainty regarding information quality, because the internet has so much information on it. Patients need some kind of decision aid or reliable source to go to, or an exercise prescription, or suggested set of exercises. So those were the results of the workshop, and a lot of those suggestions came from people attending the workshop. The results were presented 2 years later, I guess, at a Cochrane symposium in Ottawa, I believe. There was work with fibromyalgia and arthritis patients or pain patients to share key messages. By then, social media like Facebook and Twitter were much more common. We also suggested community forums and support groups, postal electronic media lists, mailing lists were also suggested, newsletters, telephone support lines, for instance, the Arthritis Society. We had learned from the workshop that geographical and cultural differences were noted, and that people in some countries sought their information in different ways, such as phone apps. So pre-appraised websites like PubMed, Medline Plus, Wikipedia, that sort of thing were suggested as good sites. And Cochrane does partner with Wikipedia, as Mary said. So our steps to success, this was on the poster, but of course it was too hard to read. Our shared vision. The roles and expectations were outlined on recruitment in the interview and were reviewed intermittently at team meetings. There was a building of trust, and time was set aside for interpersonal sharing at each meeting. The consumer role was highlighted during our regular meetings, and our opinions were well thought out. We all had to master new technologies, and as Don can attest, I'm not the most technically savvy person, and they actually were not hard technologies to master. So it worked very well. We felt that we contributed in a meaningful way to the selection of outcomes, the writing of lay summaries, and to the planning of knowledge translation. We felt like integrated, valued members of the review team, and the consumer perspective was built into the review from the beginning at the writing stages. Our challenges that we encountered, acceptance as a valued and integrated team member. I didn't really find that a challenge, but I guess it was a learning curve for everybody. Acquiring skills and knowledge. The terminology I found a challenge. As I said, I don't have a physiotherapy background, so the technical and academic terms sometimes were a bit of a problem, but they were explained and often given in a glossary, so it really wasn't that much of a problem. Using technology such as Blackboard Collaborate, that seemed to be the toughest one to master, but it wasn't all that hard, really. We did have a bit of a barrier to accessing the actual manuscript because we were not listed as authors, so we did not have access to the program I use called RevMan. So they would send us a PDF of the full application so that we would review it using well, whatever method to correct grammatical errors or language. So they would have to just send it to us separately because we could not log into RevMan. Mary felt that she may have a professional bias due to her formal training, and I'll let her speak to that.
Yeah, I mean, it had been a few years since I practiced, but I think sometimes when it came to reviewing some of the lay summaries, I would miss things that Janet wouldn't, because I might understand something that Janet wouldn't. And so Janet it's really important, her voice there, that we wouldn't miss that type of thing. So that was a bit of a challenge for me. And in terms of the authors we did talk about as a team, that's another question actually that maybe we can talk about later. But in terms of us being listed or not, and it's something that I think we're looking at too, the network. But yeah, so I did feel a bit conflicted. Sometimes I felt like, oh geez, I feel like a physio today, and other times I felt like a patient. So I really was trying to just put on the patient hat because it had been a while since I practiced, but it was a challenge for me.
So our conclusions is we felt that we collaborated in a meaningful way to the selection of outcomes, and also to the lay summary and to the knowledge translation planning. We have seen that our experience has encouraged other teams to include consumers in the planning and preparing of reviews, and that this approach has grown within the Cochrane Collaboration. And of course, with this point, we've only learned this recently. We didn't see that right at the time, but we do know what's happening now. The approach used by this team served as a model for Cochrane review teams to include consumer collaborators early in the review process rather than in the final stages. And I'm happy to report that I was at their conference last year in Hamilton, and there are other teams using consumers during the writing process. Maybe not exactly the same format we had, but they are using them. So it is starting to happen more often.
So this slide really is just to refer people who aren't that familiar with the Cochrane Library to the two different places that you can go to get these systematic reviews, which are considered the gold standard in health and medicine. And really it's any intervention in healthcare. The team comes together, synthesizes all the evidence, publishes this high quality review. So the Cochrane Library is a good starting point. It does give you both the abstract, the scientific abstract, and the lay summary. And some of these full reviews are accessible, but some of them aren't, and that varies worldwide. Some countries have licenses that everyone in the whole country can get full reviews, and others don't. So, but everybody has access to the abstract, to the lay summary, and some of the reviews we do have full access to. And the second link is a second place that you can go in, and really it's more for lay audiences and has a little bit of a different presentation, but you'll get the lay summaries there as well. So those are the best two connections to the Cochrane Library.
Okay, thank you, Mary and Janet. We'd like to open it up for questions at this point. So I think probably, well, you can either type your message in the chat box. I sent a message about that. Or you can also raise your hand in WebEx, and I can ask you to ask your question. So do we have any questions? And I'm happy to start off the questions as well, if that will give people some time to think. So maybe I'll start off with a question. To either Mary or Janet, can you tell us about what kind of potentially training or mentoring the Cochrane team provided you when you came on board to work with them?
Do you want me to start since I was on the team first?
Sure.
Okay. Well, sort of my path onto the team was a little different because at the beginning it was really our knowledge exchange task working group working with the authors. And so we got training through the knowledge exchange task force, quite a bit of training actually. And I remember going to the very first meeting and what in the heck is knowledge translation? And really none of us knew. And so we got training there, and then when I started with the team, Angela in particular was just very, just so available and explained things to me, being fairly new to Cochrane. I had done a little bit of work with the Cochrane Musculoskeletal Group in terms of a little bit of peer review as a patient representative. So I've had some training through them and through Cochrane itself before I even joined this team. So it was more organic, I guess, for me in terms of just supporting my questions. And then I'll go to Janet, because then you joined the team. And
I had been involved with Cochrane for many years, 2003, so I had been to conferences and so on where I received training. Angela Bush met with me in Vancouver. I'd already joined the team by that time, and showed me some of the technology and the expectations and so on. I met with her once in Saskatoon. The other couple meetings I had with her in Saskatoon were projects that actually didn't have to do with our writing team. But like as Mary said, she was very available for questions. And since I was, familiar with what a systematic review was and some of the steps, it really wasn't that big a learning curve. And I had to learn some terminology, of course. And so the training was kind of went on all through it.
Okay, thank you both. So Mario and I had our brains met somewhere in the ether because he asked the same question. And he was also wondering if you wanted to comment on any opportunities for improvement there, like if someone else were to join that team today, anything that you would like that you would give them a heads up on, or advice you would give to Angela. And the second part of that question was just the so-called patient selection criteria. So how individuals were brought onto the team and if they kind of needed some skills already, or what kind of criteria you were looking for. So the first one is more advice to the team today if they were bringing on people and training them. And then the second is a little bit different about the selection criteria to bring patients onto the team.
Janet, do you want to start, or do you want me to jump in?
Go ahead.
Okay, well, I think I'll start with the second part of the question first. That in terms of when we really needed another patient and consumer on the team, we really had the backup of the international Cochrane consumer network. So we were able to work with them and to kind of take, well, I mean, we kind of really just took a step back, and some of it wasn't all really that well laid out because this was quite a new thing. And so it was really just kind of like, okay, well, what is our team doing? And I mean, Angela was she was just so open to like, okay, these are all the voices the patients can bring. It's like, what are the outcomes? And we were actually able to use some of the OMERACT, the international work that had already been done by patients and other stakeholders in terms of outcomes. And it was very organic. We just basically looked at what the team did and what that patient voice could bring. Because we already had clinicians on the team. We had researchers. We didn't have policymakers, but really it was more, our target audiences really were researchers, patients, and clinicians. So it was really just, it was very organic. Janet, why don't I let you answer that one, and then maybe we can talk about what the advice moving forward could be.
At a certain point, Mary's health became a bit of a problem, so she had to leave the team. So we sent out another listserv to consumers. I was in on the interview process with one who agreed that, yes, she'd spend all that, the time committed and so on. Turns out this consumer did not work out. So she was let go from the team. So not all consumers do work out. And we ended up getting somebody else who is still with the team. So it has to be made very plain, and it was to this person, but for some reason they just didn't accept the commitment. So then that was one example where the consumer was let off the team, and we tried again, and then it worked. We got somebody that truly was committed and had a good background with Cochrane as well. I know that in my case there were many applicants. I think one of the biggest criteria was having a background with Cochrane, and a bit to do with time zones and differences, because we had some applicants from across Europe that it did turn out that we ended up with people in Europe anyway. But at that time, I think that was a bit of a consideration. As far as challenges, if another consumer was joining, while we were doing the poster presentation, there seemed to be debate amongst Cochrane people whether we should have been listed as authors or not. We were credited in the reviews as consumers, but we were not listed as authors. Some people believed we should be. Some people didn't really think it mattered. Personally, I don't have an academic career to worry about, so I didn't worry about it, but I'm guessing in the future that consumers will be listed as authors, and that's just my opinion. I really don't have much to base it on yet.
Yeah, I think that I think my understanding is that now anybody who has a substantial input into the review process, the discussion I think would be held about authors. But I echo what Janet says, because what we had these ideas that came from what we did, our workshop and all of our discussions really. But we really, to really implement some of these things that we were talking about, it's almost like we didn't have the manpower. You know, we did some of it, but we could have used a student on the team who was doing training in KT, who could have actually taken it and run with. So some of the actual implementation of all of our ideas, we really didn't have all of those ducks in a row, really. And then with changes in us and in other authors on the team, that was a challenge. Janet, would you agree? Because I was then gone. Yes. So
we did have a summer student, but they're not there long enough to really fully comprehend even what a Cochrane review is, I don't think, because they don't have a background in it. So they did help. We did have some help in preparing and producing the podcast. But people are spread pretty thin, and there probably could be more knowledge translation being done, but it's hard to get it done, like, because of the manpower, and it's all volunteer hours, including the main authors.
Yeah, because did we really, in the end, get our word? Yeah, I agree, Mario, about authors.
We're still not fully published. We still have reviews in the editing stage, so that's part of the problem too. It's a very time-consuming process to do a review. I'd say over 2 years for one review.
Yeah. And I mean, our goal was so that patients with fibromyalgia would have this evidence in hand, so they knew what really the evidence is. There's so much information out there, and we really wanted them to have this high-quality evidence. And so that's really what we're all about. We wanted to have the patient voice in the way that it was written and the outcomes that we selected, and then we wanted to work with that team and Cochrane in general to get that word out there. So that it was a big goal, I guess. Yeah.
Okay. Thanks, guys. We have we had a comment from Mario that he fully agrees with your suggestion about co-authorship. Mario, would you like to come off mute? Is there anything that you would like to add to that?
Can you hear me?
We can, Mario. Yep. Welcome.
Yeah. Authorship, I think it's crucial as we engage in patient partnership that there is full recognition of all the members around the table. There shouldn't be a two-tier approach.
Yeah.
It should be fully integrated in the core team.
Yeah.
Thank you, Mario.
Yeah. I agree, Mario.
I think it would change again if there. I'm pretty sure, but I'm not positive that it would be done differently now.
Yeah.
Okay, that's great that you guys are expressing your opinions here, because I know we've had some conversation within the network about it. So it's super to get people's thoughts here, and we can certainly use that to inform those discussions moving forward. Mute and ask your question that you posted here. Maybe I'll ask it. I'm not sure if Rebecca's having some technical difficulties. So her question is, Mary and Janet, were you able to measure how much more effective it was for Cochrane lay summaries to include patients or consumers as reviewers right from the beginning? Do you know if there was any work done on that?
I'll start with that, Mary.
Yeah,
I don't know how you would actually measure something like that. Both of us were used to writing lay summaries before we started, or commenting on them. So I'm not sure if that's something that's measurable or not. I think the terminology throughout the review might have been done a little clearer because of people like me that weren't used to the terminology. What do you think?
And well, I can't. I just want to reiterate. I'm not as involved in Cochrane now as I used to be. So something may have changed. But when we were doing the lay summary, say into 2013, 2014, the Cochrane Musculoskeletal group, which was the editorial group around these reviews, had very strict methods to the way that the lay summaries were written, and we really had to follow that template, I guess, and it was a little bit unwieldy. So I think that was a bit of a problem because it was difficult. I found it almost difficult to understand some of the. That was a challenge. But in terms of measuring the impact of us being involved versus not, we didn't get to that point. Janet, is that?
Yeah, I think it would be difficult to do. I know when we're writing lay summaries, like Mary says, there's basically almost a template you have to follow, and we were very cognizant of measuring reading levels. There are programs you can use on the computer that tell you what grade of reading level you're at. That's really all I can say about them. I don't know how you measure improvements from, before to now.
And Cochrane internationally, too, there was a working group on lay summaries or plain language summaries. So that working group, I don't know if they're still working on it or not, but certainly it was a big topic within Cochrane. And there was certainly a lot of ongoing work on the summaries themselves.
Okay. Thank you both to Mary and Janet. I'm not seeing any other questions come up. And I'd written down some questions as well, but they all got asked. So I guess, Janet and Mary, any kind of closing remarks that you'd like to make at all? Or are you also okay if people think of questions after the fact? That we get those questions to you to be answered.
Sure, I'd be happy to answer them.
Yeah.
Okay.
I mean, I just have one comment, and for me, it was like the team gave us so much wiggle room in terms of where our interests were, and these are the terms of reference that Janet presented, but they kind of let us run with some of our ideas, and they supported us in that. And for me, that was my biggest, the thing I appreciated the most was that support that they gave us in sort of going down the path with some of our ideas. And they said, yeah, they just really empowered us, I guess, to do some of these things. Janet, would you say that?
I'd agree with that 100%.
Yeah.
So it sounds like even though there were a few challenges, overall you've had a really great experience with the group, and it's also great to see that what your experiences were with the Canadian-based team, you're starting to see happen globally with Cochrane. So that's a great story.
Yeah, I found that very gratifying, I guess, to see that it, after all the questions we had at the posters, that some people have implemented it in their own ways sometimes, but definitely using consumers at the beginning and laying out, the prep that the consumers had to do and so on. So I talked to a couple and, found out what they had, consumers, and found out what they had done and, sort of almost their terms of reference. And it's just nice to see that it is starting to spread. Not all review teams have it, but some do now.
Mm-hmm. Okay, so thanks again, Mary and Janet. Thanks to all of you who have attended. We appreciate you listening, asking questions, and we are happy to take questions for those of you who sometimes like to think about things and then come up with questions later. So just let us know. Otherwise, our next series is going to be on November 2nd, and that will be about qualitative research, and that will be Richard Hovey. And a notice will go out around that. So thanks everyone for attending, and hope you have a great afternoon wherever you are.